Struggling with pain and injuries on the regular? Here's everything you gotta know about what causes the injury and how to recover safely and long-term with all these considerations, because the injuries, they just keep on coming. Let's hit it. Guys, today we're gonna be talking about things that happen to all of us, everyday injuries, okay? So, we've got slips and falls, sprains and strains, regular knee pain from walking or jogging, tendonitis, carpal tunnel. So I think all of these affect all of us at some point in our lives. I know I myself, as I'm getting to my 40s, I'm finding an injury every other week. You know what I mean? So what are we gonna do about this, okay? Let's get right into it. All of the injuries I just mentioned, none of them are, well, usually they're not specifically dramatic, obvious emergency room or doctor visits, but something I want to point out is kind of how do you assess the severity of the injury so you know what to do? Do you go to the pharmacy? Do you just rest at home? Do you go to your doctor, physio, or do you go to the emergency room? Well, there's a couple standards that we often will triage and assess in pharmacy if you come and ask us or call us on the phone. So that includes after an injury, if it's your knees or your ankles, can you weight bear? So if you can stand on it, it's often a decent sign, okay? So usually if you can weight bear, that usually means it's in the more mild to moderate category. Whereas if you can't weight bear, it might be more moderate to severe. So we're always trying to assess what is the severity. Let's say you fell a couple days ago, or you hurt yourself a couple days ago. Is the pain getting better? Is the pain getting worse? Or is it staying the same? Is the pain dull or is it sharp? Is it an ache or is it burning? All of these descriptive words are extremely important for healthcare practitioners to really assess the severity, or is it acute, short-term, versus chronic, long-term. So those are things you always got to consider. The other things you guys are going to want to assess is there swelling? Is there bruising? Bruising is an example of, you've got blood in your blood vessels, and sometimes when there's trauma, basically what happens there is a little bit of blood leaks out of your blood vessels and into the surrounding tissue. So bruising is not something so scary or dangerous. However, if the bruising keeps getting worse, keeps getting darker, the area keeps growing, that could be a sign of a bleed. So pay attention to bruising, pay attention to swelling. Sometimes when there's an injury or it's swollen, people will sometimes draw a pen mark around it to see, is the swelling getting worse? Some red flags that we're always looking for is if you cannot bear weight, if there's severe deformity, so your ankle's turned that way, if there's severe numbness or tingling, or if there's pain directly on the bone. So sometimes when you touch something and there's, 10 out of 10 pain, that could be a problem. The other thing practitioners are always gonna wanna know is assess your pain and assess your discomfort on a scale of 1 to 10. It really helps us to know, and know 11 out of 10, it's not a thing, okay? So we're talking injuries. What are your drug options? Obviously, there are prescription drug options. So go talk to your doctor about that. But with that said, it's usually stronger versions of the over-the-counter, plus or minus medications that help with nerve-related pain, or there are medications that help with severe pain, and that's where opioids are. And I think maybe we'll save that for another video where we talk about prescription relief from pain. But what can you do on your own, or what can Mr. Sparkle help you with? Basically, over-the-counter pain remedies. So you generally have your Tylenol, okay? Tylenol helps with just pain, okay? Then you've got your Advil, your Motrin, your ibuprofen. Those are anti-inflammatories. You've got your Aleve. Now, anti-inflammatories, as many people know, they help with pain, but they also help with inflammation. So usually a short-term acute injury, there is inflammation. And then the last over-the-counter pain option that we often talk about are your rubs, okay? So for the most part, the main thing I like to tell people about rubs is many of the rubs, especially the hot and the cold related rubs, they don't always necessarily get to the bottom of the issue, okay? So they don't target the actual problem as much as it feels nice. It gives you relief. It can be soothing, you know? So the cold, the icy, the deep relief sensation you get from the cold related items is somewhat like icing and can sometimes help with inflammation, but for the most part, it's the sensation of cooling that's helping, but it's not always actually working as a real anti-inflammatory the way Advil would or the way icing would, okay? And then alternatively, the heat rubs, much like using a hot water bottle, it feels nice, it can be soothing, but it's not necessarily doing anything. It still feels good. The only rub that really is a bit different is Voltaren. So Voltaren is an anti-inflammatory like Advil. It has diclofenac, which also available as a prescription pill that you can take. But this rub is available. When you're using this rub, try to remind yourself, it's not just a little hand cream that you're putting on. No, you're trying to use it as an anti-inflammatory. So we really want you to massage it into the affected area for deeper penetration. If you find this is mildly effective, but you need something stronger and you need something long-term, compounding pharmacies can make that in a stronger strength. So over-the-counter Voltaren or diclofenac is like 1%, extra strength 2%, but we can compound it into 5, 10, 15, 20%. Or we can switch it up to ketoprofen, for instance, instead of diclofenac, which has better penetration, okay? So let me know. So some considerations about this kind of medication. Obviously Tylenol, most people are comfortable with and feel good about it. Tylenol has a very safe profile. People often get worried about liver, and I don't want it to cause liver damage. Well, if you don't have a pre-existing issue with your liver, it should be fine. Check with your doctor just in case. You can always proactively get blood work, especially if you're going to be taking it more chronically. But Tylenol is generally a bit safer, especially for a senior population. There are times where if you're going to be taking Tylenol regularly, you might want to go with extra strength versus Tylenol arthritis. And then, as I said before, the Advil, please be careful if you're not sure if you're allowed to use it. It does have some contraindications, so you need to be careful if you're on blood thinners. You need to be careful if you have kidney damage. You need to be careful if you have a sensitive stomach. However, with that said, it is often the go-to as an anti-inflammatory because it helps with pain and it also helps with swelling. You don't want to take any prescriptions? Well, there's always some non-drug options. So you can obviously listen to the classic acronym RICE, rest, ice, compress, elevate. So having your leg elevated can be helpful to help drain any of that inflammation. Resting, hydration is obviously always very important. Icing, I can show you a couple things about icing. So you can, if you've had surgery, you can always consider an ice machine, which provides continuous cold therapy. But if it was just a short-term injury, you might want to grab an ice pack. Sometimes for bigger injuries, I myself, what I like to do is get 2 ice packs so that there's one in the freezer, the other one I'm using right now. And then that way, if I forget to put this ice pack in the freezer, when it's time to ice, I've got another one ready. The other thing I like to do at home is when you have a really cold ice pack and you put it directly on your skin, you could basically cause freezer burn or damage the nerve tissue on your skin. So what you might want to do is put a very thin cloth in between the ice pack and your skin. Personally, I find it doesn't penetrate as well. So what I like to do myself is I actually get a couple pieces of paper towel, and don't soak the paper towel, but just lightly sprinkle some water on the paper towel, and then the ice pack really transmits that cold to the skin well, but at the same time, you're not having that direct action. Also, sometimes nice, it's good to get one of those bands and wrap the ice pack onto the affected area so that it's nice. Only need it for 15 to 20 minutes. Keep it on for too long is unnecessary, and as I said, can cause damage to your skin. So icing, especially when it's a short-term, new, fresh, acute injury, can be very helpful. The other thing that's amazing to consider are, compression support braces. So I recently had a bit of a slip and fall myself. I didn't fall, but I did one of those where you catch yourself. But while catching myself, I tweaked my knee. So in my right knee, I happen to have had ACL recovery surgery, 10 plus years ago. Then I tore my meniscus a couple years ago doing nothing because I'm almost 40. So every now and then I pop a brace on. So on the left knee here, just to show you, I've got a very mild brace, which is basically just more of a sleeve, okay? Whereas on the right knee, I've got a bit of a more intense one, which includes metal stays up the side to prevent hurting your knee this way. And it's got a nice little donut surrounding my kneecap, which helps to stabilize the patella and stabilize the joint. So depending on the different type of activity, I will wear something different. If you're a pro athlete like myself, then sometimes you might want to consider athletic gear. So we do have, for instance, these McDavid leg sleeves or thigh compression or compression socks. So these are specifically made less for somebody to wear it the whole day, but often it's made with neoprene, which is supportive but breathable and specific for athletes. So if you're a pro athlete like your boy, you can always check out these things, but basically wearing these braces can be very helpful. So myself, since I just tweaked my knee the other day and I don't want to further injure myself, that's where I decided, okay, I'm gonna wear the brace for the next couple days. I'm gonna ice for the next couple days, try to take it easy. Maybe I'll skip leg day, woo woo. But with that said, part of non-drug therapy options include, after the injury's acute portion is done, well, you might need to start going to physio to rehabilitate that joint, okay? With that said, you might need to make sure you're not skipping leg day, because part of the issue with the injury I had is if the little joints I have are getting weaker and more sustained injuries, then more reason to make sure I'm exercising, strengthening the other muscles so that they can support each other. You know, many of the cartilage and joints we have are made up of elastic bands, okay? So sometimes when you overly stretch an elastic band, as you've seen, it's never quite the same, okay? But many times what it just needs is, the body is a beautiful thing, and many times what the body needs is to recover. So for instance, this band that I'm wearing here on my arm is very helpful if you've had tennis or golfer's elbow or any sort of injury in this area due to repetitive use. So often there's like an elastic here, basically like this, and when it gets overly stretched, you have pain and discomfort. So what this band will help to do is compress on that band so that you don't use it as much, so it gives it time to rest. So I often suggest using these guys for 4 to 6 weeks for golfer or tennis elbow, and it can be quite effective if you stick to wearing it long term. Guys, if you found this video helpful, like, comment, subscribe, and let me know what you want to talk about next, okay? I'm your personal pharmacist in your pocket. See ya.